This is a public service announcement for progressive supranuclear palsy, or PSP. Progressive supranuclear palsy is also known as the Steele-Richardson-Ozarsky syndrome. It is also a rare progressive neurodegenerative disease. Progressive supranuclear palsy affects 5 out of 100,000 people in Canada. People over the age of 60 years old are affected, and men are at a greater risk for developing PSP compared to women. PSP occurs from cells dying in the brainstem, cerebral cortex, cerebellum, and basal ganglia. It also results from the development of tau protein in the brain. This image illustrates where the tau protein attacks in the brain for patients with PSP. Symptoms for PSP can be cognitive changes such as memory, trouble with balancing, like falling backwards easily, trouble with vision, such as double and blurry vision, difficulty swallowing, such as dysphagia, and depression, anxiety. People with PSP often have sudden outbursts of crying, and they are unsure why they are expressing sad emotions. Diagnosing progressive supranuclear palsy is very important. It is also difficult, considering the variants of PSP, like PSP speech-language, PSP frontal, PSP corticobasal syndrome, PSP progressive gait freezing, and PSP Parkinsonism. Brain imaging techniques are also helpful, such as MRI techniques, like free water diffusion or MRI. Dopamine transporter or DAT scans are also helpful for patients who have lesions in the striatum, and tau PET scans, where they are helpful for PSP and other tau-related disorders. The main cause for progressive supranuclear palsy is tau protein development, while there are a couple of risk factors to take into consideration for PSP. Genetic is one of them. There is a genetic link between sporadic and familial PSP, as well as MAPT mutations seem to also identify genetic mutations in PSP. However, there are environmental factors that play a big role for PSP development, such as chemicals and metals in the water we may consume, toxins, and educational levels. For example, low education may cause cognitive deficiency. Unfortunately, there are no treatments or cures for progressive supranuclear palsy. However, there are different ways to manage progressive supranuclear palsy symptoms. Medications are one of the many ways to manage symptoms for PSP. Levodopa is a main medication for treating rigidity and other movement symptoms for PSP. Amantadine is another medication for treating rigidity in PSP. There are vision methods, such as using eye drops for patients with PSP who have dry eyes, prism glasses for patients with PSP who have double vision problems, or Botox injections to relax patients' eyelids so they can open and close their eyelids. There are more ways to manage PSP symptoms. For example, using antidepressants are recommended for PSP patients who are impacted by mental health issues like depression or anxiety. There are also physical therapy options, such as physical therapy that improves function and decrease the number of falls people experience with PSP. Occupational therapy is used for observing the safety of the patient's home and improving the quality of their life. Speech therapy helps people with PSP for communication disorders, safe swallowing techniques, and it can lead to a diagnosis for any problems with their diets. Social worker and palliative care consultants are responsible for home placements, end-of-life care, and quality of life for their families, as well as immunotherapy methods that are recommended for tau-directed immunotherapy to slow down tau protein development in PSP patients. There are different organizations in Canada that spread awareness about progressive supranuclear palsy. PSP Society of Canada is located in Kingston, Ontario, and they provide awareness, latest research of PSP studies, and tau protein pathology studies. There's also the Colleen Cunningham Foundation. This is a non-profit organization that brings awareness about progressive supranuclear palsy. They are located in Burlington, Ontario. There's also the Rosie Progressive Supranuclear Palsy Center. They are located in Toronto Western Hospital. This is the first clinical center in Canada that fully focuses on the diagnosis and management of progressive supranuclear palsy. The last organization to mention is Parkinson's Canada. Their centers are located across Canada. Their following centers are in Nova Scotia, for example, New Minas, Dartmouth, Bridgewater, Sydney, and Amherst. Although these support centers are focused for Parkinson patients, they may be able to acknowledge symptoms for atypical Parkinson diseases, such as PSP. This website also has a tab that discusses the atypical Parkinson's, where PSP is categorized as, since it does have similar symptoms to Parkinson's. Thank you for listening to this public service announcement about progressive supranuclear palsy. Continue to spread awareness for this neurodegenerative disease.